Filling posterior restorations with traditional layering techniques is a time-consuming process, requiring multiple steps. Each 2 mm layer has to be placed, adapted, and light cured before the next layer can be added. What if you could fill cavities up to 5 mm and eliminate the need for incremental layering of multiple layers, and at the same time have effortless adaptation, non-sticky handling, fast and easy contouring, full-depth cures, and superior strength and wear, all in one material? Now you can with SonicFill. A first-of-its-kind, time-saving composite system, SonicFill enables clinicians to perform posterior restorations with an easy-to-use, single-step bulk fill technology that requires no additional capping layer. This module will introduce you to SonicFill and show how its innovative sonic activation delivery system lets you go from placement to a polished restoration in less than 3 minutes on cavities up to 5 mm in depth. Is SonicFill a packable or a flowable? The answer is neither. SonicFill is a unique composite and delivery system comprised of a specially designed handpiece and proprietary composite material packaged in a uniquely designed unidose tip. The handpiece applies sonic energy to the tip while dispensing the material. Special modifiers in the SonicFill composite react to this sonic activation, causing the viscosity of the material to drop almost 90% during extrusion, allowing SonicFill to intimately adapt to the internal geometry of a cavity. All composites will reduce in viscosity when sonic energy is applied. But as we can see in this graph, SonicFill's reduction in viscosity is almost 3 times greater than other composites when exposed to this energy, which allows for superior adaptation and quick filling of the cavity. Once placed, the material returns to a higher viscosity that is easy to sculpt and contour. Add in SonicFill's superior strength, low shrinkage, and high depth of cure, and you get a composite material that can be placed, adapted, and cured in a single increment of up to 5 mm in just 3 minutes. When dentists were asked what improvements they would like to see in posterior composites, they identified the ability to bulk fill, ease of placement, and improved adaptation and wettability as their top 3 choices. SonicFill delivers all these and more. SonicFill can bulk fill up to 5 mm depth without a capping layer, allowing dentists to fill most cavities with a single application. The curved tip and handpiece allow for fast, accurate placement even in challenging posterior areas. When sonically activated, the material offers superior flow and adaptability without stickiness. And because the material can flow into geometric areas of a cavity without manipulation or pullback, it produces a tighter marginal seal. SonicFill offers excellent adaptation to cavity walls, high radiopacity, and it minimizes voids without manual condensing. When using SonicFill, the use of a liner is no longer necessary. The single increment technique produces a superior result while reducing patient chair time and improving doctor productivity by increasing the number of procedures you can perform. Let's look at how this sonic activation system works. The handpiece attaches to the air line on the dental unit using a multiflex-compatible coupler and is controlled by the rheostat. The composite material is housed in a chamber inside the unidose tip and contains 20 to 30% more material than typical unidose tips. The tip and chamber are protected by red covers that are easily removed for application. The sonic wave is initiated inside the handpiece and transferred to the dispensing nozzle on the tip, where its specially designed geometry and shape maximize the transfer of sonic energy from the handpiece. The dispensing rate is selected by turning a dial at the base of the handpiece. 5 is the fastest setting and 1 is the slowest. SonicFill is designed to make all posterior direct composite placements easier and more efficient. To apply SonicFill, remove the protective covers from the tip and composite chamber, insert the tip into the handpiece, and screw into place. Set the dispensing rate at the bottom of the handpiece and place the tip at the bottom of the cavity floor, adjacent to the matrix band if applicable. Using the foot pedal to activate the handpiece, fill the cavity in a steady, continuous stream, keeping the tip below the composite surface, withdrawing it as the cavity fills. From the occlusal surface, compress the material to ensure there are no gaps and adapt the margin. Remove any excess material and sculpt the anatomy. Light cure for 20 seconds and remove any excess bonding agent and composite. Kerr also recommends 10-second buccal and lingual cures. Independent data confirms SonicFill's depth of cure with a light output as low as 550 milliwatts per centimeter squared. SonicFill offers several convenient packaging options, including an introductory kit that contains everything you need to start placing single-increment posterior restorations, a value kit for clinicians who need a greater volume of material, and a refill package that includes 2 10-packs of Unidose tips in 4 different shades. Handpieces are also sold separately. SonicFill gives you the best of both worlds by combining the ease of handling and superior adaptation of flowable composites with the strength and durability of bulk fills. You can fill up to 5 millimeters in one increment with no capping layers, which means most cavities can be filled with a single application. You get excellent handling and superior adaptability without stickiness. The material is easy to sculpt and finish and cures to full depth in just 20 seconds. The Sonic Activation Delivery System reduces procedure time by up to 60%, and you get high strength and low shrinkage for long-lasting posterior restorations. To go from placement to a polished restoration in just 3 minutes, choose new SonicFill from Kerr.